In this slide presentation, we are going to discuss value-added service delivery. After completing the analysis of the external and internal environment and the strategic formulation activities and the strategic choices have been made, the value-added service deliveries need to be assessed for implementation. The emphasis for this class is less on assessing and more on value creation. A key point to be made in this discussion is that the service has to add value from the customer's perspective. It is not what staff or marketeers believe may add value. Therefore, marketing research plays an important role to engage actual customers in the process, gaining their thoughts and feedback. Clinical delivery has a marketing component in today's healthcare environment. If patients are not satisfied with any aspect of the healthcare delivery, they have choices and they are exercising those choices. Thus, from bedside manner of the physicians and nurses to the use of various therapies, customers today are more engaged in their health and will make decisions based on personal assessment of service delivery. When looking at the value-added service delivery, you should look at the pre-service, point of service, and after-service components of the service delivery. As you will recall, there are two main components of the value chain: the service delivery and the support delivery services, and they are interrelated as implementation strategies. Implementation strategies are part of the means to the ends chain, similar to other strategies developing strategy formulation. The implementation strategies incorporate the service delivery and the support strategies, as well as unit action plans. However, service delivery is critical to the success of a healthcare organization. Providing a product or services and delivering it to the customers are the central activities of healthcare organizations. Organizational requirements for a strategy must be matched with the current organizational resources, competencies, and capabilities to determine whether current activities need to be maintained or changed. Each of the strategic decisions, be it directional, adaptive, market entry, and competitive strategies, moves the organization towards achieving its mission and vision, yet requires the organization to plan specific activities to make it happen. The value chain strategies provide a general direction to the organizational units concerning ways to carry out the strategies. Pre-service delivery includes marketing and market research, identification of services to be offered and the target market for them, the branding involved, pricing, distribution, and promotional decisions. As a reminder from previous slideshows, market and market research determines target customer wants, needs, and desires. What do potential customers of a specific service category in a particular service area want? Services are defined as a deed, a performance, or an effort, and are different from physical goods because of the following characteristics. 1. Services are intangible. 2. Services are variable. 3. Services are perishable. 4. Services are inseparable. And 5. In healthcare, services are often paid by others other than the patient. The healthcare customer sought is referred to as the target market. Many healthcare organizations have one or more of the following as their target market. Number 1, physicians. Number 2, patients. Number 3, third-party payers. Branding is a promise of a specific level of quality, and once learned by the customer incorporates a sense of value and set of expectations. Brands are identifiers that differentiate quality and service delivery. Pricing in healthcare is challenging because it is difficult to understand costs. Someone other than the patient often pays for the care, and prices are too low are suspected of low quality from the customer's perspective. Considering distribution and logistics, decisions need to be made to determine the availability of healthcare based upon logistical distribution. Promotion includes any paid form of communication with customers and potential customers. It can be used for positioning, building awareness, reminding, and differentiating between other service providers. When considering adding value to the services being delivered by an organization, pre-service activities should be considered in relationship to the situational analysis, strategic analysis, and strategic formulation to identify activities that could increase value to the organization. When considering adding value to the point of service area, consideration must be made to the current services that are being provided by the organization, quality assurance, innovating the processes to add value, and marketing. Mass customization is meant to increase customer satisfaction and lower cost. An example of this might be the advent of case management services within a facility in order to minimize hospitalization costs and maximize service delivery and reimbursement. Quality of care is critical, but who determines the quality? Are patients capable of determining the quality? Are the expectations so high that death is considered a failure? Quality measures are continually being implemented into facilities to improve the delivery of services, to minimize the cost, and increase the efficiency of service delivery. With the advent of the new ICD-10 being distributed in the future, additional coding will be attached to all cases, which will allow individuals to assess the quality of care and assess care based upon outcomes. Clinical process innovation is a method to improve quality of care by introducing new ways of doing things rather than improving the current methods. In the value-added service delivery category of marketing, we should be looking at adding value in the marketing component of patient satisfaction, product development, market development, penetration, enhancement, and differentiation. When considering value-added marketing services, consider the market research that focuses on patient satisfaction to ensure that the delivery of care at least meets their expectation. When looking at quality improvement, base it upon customer expectation. When looking at speed of delivery that can be managed through patient education, this is an innovation that could process patients through the system faster and improve their satisfaction with the knowledge that they receive of their health care. Change strategies are required when customers are going elsewhere or are dissatisfied. Therefore, constant customer contact is necessary to determine why patients are going to other providers. Finally, maintaining strategies does not equate with just remaining the same. It means continuous quality improvement. When looking at value-added services in the after-service delivery, it's important to continue to look at how do we add value to the follow-up services, billing, and follow-on services. As we know, follow-up care is done after the initial encounter. Often we've found that billing processes are a source of high dissatisfaction with customers who cannot understand the codes and charges. Perhaps this might be some area to improve value-added services, which will therefore increase customer satisfaction. Follow-on services activities are primarily arrangements for future care. Value-added service delivery strategies provide implementation of the strategies discussed in and considered in the analysis and strategy formulation. It's important to implement these strategies because of the interrelatedness of all the value-added service delivery strategies. It's also important because of the competitive advantage it can create within the organization's delivery of services at all levels of services, and therefore increase the competitive advantage of the organization with other service providers. An organization that succeeds in differentiating itself serves as a model for new competitors. Thus, value-added service delivery strategies have to be continuously evaluated and either maintained or changed to ensure competitive advantages or strengthen the organization that has competitive disadvantages. And finally, as previously discussed in other slides, presentations, the critical success factors are imperative in having an organization be successful. The service category critical success factors, being the primary requirements for success in a particular service category, and the mission critical activities, those activities that must be accomplished if the mission is to be realized, are vital in looking at value-added services. As an example, one may want to look at the service market, a strong information system, a low-cost structure, the ability to replicate services in other geographic areas, and or the ability to accept near-term risks. When considering value-added services and looking at the critical success factors, be sure to focus on the organization's specialization, their reputation, the services or products that they're delivering and the quality of those products and services, their technological leadership, their ability to utilize vertical integration, their ability to position themselves based upon cost, looking at the particular services and the differences of services that they may have with competitors, what the pricing policy of their organization is, and finally, when a organization is part of a larger company, what that relationship is with the parent company. With organizations that have relationships with a parent company, there is often additional bureaucratic processes